Dr. Arvind Morya, sir, will be speaking on ORTHOPTEK, Magnocellular Stimulator, a novel innovation in the management of amblyopia. Dr. Arvind, sir.
Thank you, sir. And good morning, respected judges and all my dear friends. So I will be speaking on our innovation, that is ORTHOPTEK Magnocellular Stimulator, a novel instrument for the management of amblyopia. So all these traditional, conventional management of amblyopia, they are very tedious and very problematic. And sometimes they also cause the reverse amblyopia in the better eye. So it's real time to think beyond the conventional therapy. So the answer is ORTHOPTEK Magnocellular Stimulator. So what is the hypothesis behind it? So impulses from the retina, it goes to the optic chiasma, and then through the optic tract to the LGN, it ends along with the optic radiation in the V1 area of the occipital cortex. And here the 4C alpha, so the magnocellular cells, they send the discharge here, and 4C beta, the parvocellular cells. There is dichotomy in the visual pathway. So from the retina magnocellular, they are responsible for the peripheral area, goes to the LGN1-2 ventral area, and the parvocellular central area, they goes into the 3, 4, 5, 6 LGN dorsal area. And now the inherent connections are there. So parvocellular going into the layer 4C beta in the V1, and the magnocellular, they are going into the layer 4C alpha in the V1. So these attention and saccadic, they have reciprocal action against them. But this 4C alpha, they have, because of their horizontal connection, they have positive stimulation towards the 4C beta parvocellular layer. So these repeated stimulation of the magnocellular cells, peripheral cells via the attention area and parietal cortex leads to stimulation of fovea, and these prosaccades are associated with maximal stimulation of the V1 area that is most affected in amblyopia. So this is how it is done. There are 3 rows of LED. So patient is asked to sit 1 meter behind and follow these lights with the help of the green laser. These lights comes on and off for 150 milliseconds. So we did the world's first clinical trial between phakic versus occlusive versus ORTHOPTEK. So results were really good in all the 3 categories, but when we compare the contrast sensitivity, it was maximum in ORTHOPTEK group with a significant p-value as compared to the other groups, and also stereo acuity in ORTHOPTEK group with a significant p-value as compared to the other 2 groups. So in conclusion, ORTHOPTEK Magnocellular Stimulator is a novel instrument in the management of anisomyopic and isomyopic amblyopia in terms of faster improvement in contrast sensitivity and stereo acuity for faster achievement of binocular single vision. And amblyopia is a brain abnormality. As you see in the upper picture is a functional blood oxygen level dependent MRI in a normal patient. And the second picture is of a amblyopic patient. So there are structural deficit in the visual cortex, and the functional MRI scan, they show a drastic reduction in the oxygen consumption in the cortex of amblyopia patient. And after treatment of the ORTHOPTEK, there was the oxygen supply and the blood supply increased. Thank you so very much. And the innovator is with us, Dr. K.S. Santhan Gopal from India.
Thank you. The judges, please.
Just one question. You are talking about anisometric amblyopia. What about the strabismic amblyopia? Has it is same role?
Yes, it has same role. Also, the degree of strabismus has also decreased as per one study done by Dr. Santhan Gopal and the rest of the authors. So degree of strabismus also decreased. There are 12 uses of this ORTHOPTEK Magnocellular Stimulator in nystagmus also. And in the attention deficit, the children also, Alzheimer patients. So it has 12 indications.
So just one thing, there is a connection between the parietal and to the temporal cortex also. So if there is any functional dysfunction in the parietal cortex, will it affect the stimulation thing? Okay.
Exactly. It is a problem in the brain.
No, that I understood. I'm saying if there is a lesion in the parietal
definitely.
Cortex, so will this affect your therapy?
No, it doesn't affect our therapy. No.
Any more judges' question?
I think you talked about functional MRI in these cases. If you look into long-term results, will they sustain
Yes.
changes happening in these cases?
Recurrence is not there, sir.
Okay.
It's sustaining for 9 months. In few of my patient, we doesn't require this therapy.
Okay. What about the younger patient where you require a much more attention in these cases?
So we are sitting with them. Yeah, it's a major problem. They were not improving, but when we started sitting with them, they started responding well.
Good, good, very nice.
And it's hardly 20 minutes therapy. It doesn't take much time. So we can make them concentrate for at least 20 minutes. Thank you, sir.
Thank you,
Thank
sir.
you so very
I'd like to request Professor G1 TTL, sir, to please give a certificate of appreciation to Dr. Arvind.